It's critically important that people consider family medicine as a career choice, just simply because of the aging population and the demand that's going to be placed on the healthcare system down the road.
And why not us? Why don't we get involved with that so that we can do something locally? Help the medical profession, I guess, as a whole, but just as important, maybe give something back to this community that would allow us to sustain our medical expertise, you know, as the years come. We're all part of the same team. And the DO program and its residents and students are a part of that. They're part of the family.
My first day at the hospital was my interview, and I knew right from the get-go that it was a very warm, friendly environment. When I'm walking up the hall, I saw some nurses that smiled and said, "How are you?" You know, I thought, man, they treated me like a neighbor from the get-go, and I knew from the interview that this would be where I was going to do my residency.
I just think it's the very relaxed atmosphere that's so conducive to learning.
What attracted me to Methodist Hospital when I interviewed over here? A third-year medical student is no lower on the totem pole or the hierarchy than senior resident. Then is the ER attending, who's the medical director of the program. It's an equal team effort, and everybody's learning together, and that you don't get degraded because you don't know. And a lot of the feedback from over here is, if you don't know, stand up and raise your hand and we'll teach it. If we don't know, then we'll go find someone that does know. And it's not a humiliating situation as it has been in other programs that I've seen and been at.
You're the first assist on surgeries, the first assist on OB deliveries, and standing at the right hand of your attending, whether it be in family medicine or pediatrics. This provides an ideal learning environment and a way for you to feel most comfortable when you enter the real world of practicing medicine.
Hopefully, if Henderson is the type of place that someone would like to live, then we can continue that process afterwards and help you get your career started and established.
Finishing up residency and opening up a practice in Henderson, Kentucky was a very scary feeling, and it was nice to know that the hospital was here, not only to aid me in setting up practice. The community supports everything that this hospital does, and this community knows that it needs younger, newer physicians, and this hospital recognizes that. And this hospital has opened up its arms to caring and kind physicians that they know will take care of their community.
One of the nice things about going through residency here and going into practice here, all of the attendings that I trained under are available to me. Should I ever get into a bind and have a question, I feel more than comfortable approaching them to help me out and help the patient out.
We have had total support from the medical staff, and as a result of producing good physicians, I'm happy to report that we now have 4 physicians in practice within this area. 3 of those are in hospital-based facilities, and a 4th is a Foresight student who came here in junior and senior year and returned later to open a private practice. We are a core site for the Pikeville College School of Medicine and accept 4 junior and 4 senior students each year, and this has enhanced our program.
Well, as we looked at the whole process of the DO program, one of the things that we wanted to make sure was that we did have some kind of continuation of care. The Continuity Care Clinic was the answer for that. That provided a space and a service, you know, for our community, for those people who do not have physicians that could come in, still get their follow-up care, would help them from a personal standpoint, and then also help our DO students in their educational process, because they would be involved in that care and in that follow-up. And so I think it solved 2 issues that we had. 1, coverage for the community, and 2, more education for the students as they were here.
Opening about a year and a half ago, we have a continuity clinic with 7 exam rooms, one of which is a negative pressure room.
As a resident, I had the luxury of working in the Continuity Care Clinic, which is a vital part of our training. It allows us to practice independently and alone, not necessarily always with direct supervision. However, there is always an attending physician around should a problem arise.
The clinic offers so many opportunities to see people of the lower incomes who are in need of medical care in all stages and forms of disease, and these people would not ordinarily get the medical treatment that they need.
Here in the Continuity Care Clinic, we see patients who, for the most part, do not have insurance. It is a free clinic, and so we're able to see them for ongoing health issues such as hypertension, diabetes, high cholesterol.
The best thing about residency so far has definitely been patient management. Going from a medical student to where you're on the sidelines, not being able to do what you want to do and express your knowledge, to go into residency here to where I have clinic a half a day a week where I see my own patients and manage my own patients, and that's really special.
Working in the clinic gives you enough freedom to find out your pattern as a doctor. The staff's there to support you and make sure that you do things within limits, and they let you find your own individuality as a physician at the same time.
It teaches us to be confident, teaches us to be excellent diagnosticians, and it teaches us how to treat patients, how to listen to patients, and how to diagnose.
We believe we have an excellent program, and we hope you'll give consideration to spending your 3 years in the residency program in this facility. I think you may find other programs that may be equal, but you'll find none any better.
At Methodist Hospital, I think that if you talk with any one of my residents or interns, you'll find that most all of us agree that it's just such a privilege to be associated with an institution such as this, an institution that tries to live out its mission statement every day.
I would think, and I'm probably a little biased on this, but I would think a student coming out would be looking for great opportunities and to be in an organization that has its mission well defined and is part of its everyday life, and that will treat those students with the utmost respect and not only, again, to provide space for their educational process, but to invite them in as part of our family.
The residency itself gave me a life. I wanted to come in and have a life of my own rather than giving the residency my life, and it's an important balance that I've looked for, and which I found here. I can do residency here and have a life of my own as well.
This residency presents the opportunity to interact with all the attendings of every specialty and hands-on experience.
The town of Henderson is a wonderful place. The community has been very supportive, along with the hospital staff, and I can't think of a reason why you wouldn't want to come here.
I absolutely enjoy being a physician finally. It's one of those things that after going through medical school, after going through internship and residency, you think it's never going to get here, and living paycheck to paycheck. It's nice to finally say this is where my practice is, and hold your head up a little bit higher and be a little bit proud of your accomplishments.
The residency program has been wonderful. I don't doubt my decision to come here one bit, and it's been the best decision of my life.